Welcome to the Salmon Runs YouTube. Enjoy the video.
You start by confirming the surgeon's clearance and reviewing the removal plan. This ensures safety and avoids surprises. Once confirmed, open a sterile tray and lay out instruments in order of use. Drape the area and put on gloves. Make sure the limb is supported and elevated to reduce bleeding. Apply sterile towels and adjust lighting for clear visualization. If local anesthetic is ordered, draw it up now. Explain what you'll do and get verbal consent before proceeding. Begin by cleaning the area thoroughly with antiseptic and removing old dressings so you can inspect the wound and pin tract for infection. Once clean, sequentially loosen external nuts or clamps while an assistant holds alignment because controlled counter-torque prevents sudden movement. Use the correct driver for each head size. Keep motions smooth. When a pin is ready, withdraw it with steady axial traction. Do not twist violently. Place each pin in a sterile container and document length and appearance. After all pins are out, inspect each tract, irrigate with saline, and apply pressure to control any bleeding. Then dress with sterile gauze and a secure bandage. Explain aftercare to the patient. Keep dressings dry for 24-48 hours. Watch for increased redness, fever, or drainage, and follow prescribed antibiotics or tetanus prophylaxis if indicated. If you encounter resistance, a bent pin, or sudden severe pain, stop immediately. Immobilize the limb and notify the surgeon so imaging or operative removal can be arranged.
Thanks for watching. Consider subscribing if we helped you.